our four speakers of the day. The very first speaker will be Dr. Sampoornam Webster. She is the chairperson for today's event. And next is Dr. Aparna Gopi. And the next one is Miss Yaren Dogan. And the fourth one, last one, is Miss Lara Dinjar. I am really sorry if I'm not pronouncing your name right. I will definitely make sure that I'll learn the pronunciation correctly from you. So please feel free to correct me.
Excuse me, dear. I'm Aparna speaking. I just have one request that myself is I'm working as a staff nurse. I'm not at all in the doctor profession.
Okay, apologies.
Yeah, no problem. Thank you.
So can I please call you Mrs. Aparna Jishnu? Will
Yeah,
be
sure. Yeah, fine.
Thank you so much. Thank you so
Yeah,
much for correcting me.
yeah. Thank you, dear. Thank you.
Thank you. Thank you, Lara, for confirming. You know, I'm usually worried about if I'm pronouncing somebody is wrong, as I can't tolerate if someone call my name with the wrong pronunciation. It's not in the rude way, but yeah, I love it when they pronounce it in their own ways also. But yeah, it's Ghazal Johar. I'm repeating again. If you forgot, please ask me again. To everyone.
I just wanted to say that I know you're not speaking Croatian, and my surname is appropriation is Dinjar, not Dinjar, but it is okay. I'm okay with that. Don't worry, really. It is not that big deal.
That's so sweet of you, Lara. But let me learn it. It's Dinjar. Dinjar.
Yes, Dinjar.
Thank you so much. I'll take a note of it. Okay, so before going for our first talk of the day from Dr. Sampoornam, let me ask a very simple question to all of our attendees. All right. So please let us know if you have or you have personally experienced a mental health crisis. No. The question was, if you have or anybody you know have experienced mental health crisis. There are a few people on LinkedIn Live also who are saying yes for it. Okay, there are a few people who want to know more about it as they are currently experiencing it. We definitely hope we can help you. Okay. So what if you got to know that a chatbot could be a valuable resource in those moments? Can you imagine? The question is, can you imagine a chatbot could be helpful in such moments? To attendees in the meeting room also. Do you think a chatbot might help? Thank you, Meghna, for the answer. Okay, Tanya. So Tanya, do you think a chatbot might help? Okay, Antul think that chatbot, he don't think or she don't think that chatbot could assist properly. Exactly, Patricia. That is what are my thoughts too. And Patricia said she thinks that it would be better if it could somebody could help face to face. But yes, it's still better than nothing. Let us know more on this topic. We will definitely. Okay, Shama, we will definitely compare the two also. We will ask our speaker, our chairperson. Right? So let me quickly provide some guidelines for the duration of the chat. So if anybody has any questions, all right, if anybody has any questions to be asked from the speaker, please make sure you write down the question first in the comment section or in the chat box for the people who are in the meeting room right now. Please make sure you write down the questions in the meeting room in the chat box. And to those who are in the LinkedIn live, please make sure you write down your question in the comment box. All right, we will definitely try our best to ask the question from the speaker. And we will definitely try to get the answers also. Okay, so let us just let the talk go smoothly, then we will ask the questions later on. We are already having the questionnaire sessions for all the talks, after talks, right? Are we ready for our very first talk, everyone? We ready? Show me your energies. Are we ready? Yes. Thank you so much, Shaman. Thank you, Meghna. Thank you, Tanya. Thank you, Amar. Thank you, Carissa. Thank you, Dr. Sorry, it's Mrs. Aparna. Thank you, Lara. Ready. Great. So let us call Dr. Sampoornam Webster. Or should I call Principal Sampoornam Webster?
No, it's Dr. Sampoornam Webster.
Still?
Yeah.
All right. I will keep calling you Dr. Sampoornam Webster. Welcome to the event, Doctor.
Yeah, thank you so much.
So are we ready? I'm ready to explore more, to know more. Are you ready to share more?
Shall I take over the session, Gezel?
I'm sorry?
Shall I take over the session?
Perfectly, yes.
Fine.
Screen is all yours. All the very best.
Thank you. Yeah. I'm Dr. Sampoornam. Regarding bots and digital mental health. It's a very small topic. So you all would have come across the term crisis. It is a state of like feeling an internal experience of confusion, of course, anxiety. Somebody put in chatbot like anxiety and depression. Yes, of course, it is a feel of anxiety and depression. Mechanism fails and the individual is unable to take effective decision. That's the thing here. So here, individual is unable to take decision because of crisis, and of course, anxiety and depression develop. In a nutshell, really this chatbots at present, it helps to just come out of crisis. So here I've just highlighted some of the points regarding chatbots and of course digital mental health. So artificial, I want to brush up the abstract. Artificial intelligence powered chatbots are being developed to provide immediate mental health support during crisis. And of course, these chatbots can offer like coping strategies, of course, resources, some of the referral services to the professionals like counselors, psychologists, clinical psychologists, etc., etc., even nurses. Crisis chatbots and digital mental health tools are innovative solutions that leverage technology to provide support resources and interventions for individuals dealing with mental health challenges. As in day-to-day life, we all face crisis. So, so crisis chatbots, it works 24 hours into 7 availability. Just imagine every day, 24 hours it works throughout the week, 7 days. Of course, months, years, it works. So this crisis chatbots are designed to be available round the clock, providing immediate support to individuals in time of crisis, such as when experiencing suicidal thoughts, extreme anxiety, and emotional distress. See, suicide is really uh, provoking the whole world. I could say even a 5-year kid is having suicidal thoughts. It is unimaginable. So at present in my clinic, I receive like 7 years old, 9 years old children all with suicidal thoughts. And next point could be like anonymity and privacy. So while talking about anonymity, yeah, the person's identity is really unknown. This get confidential, and many individuals feel more comfortable discussing sensitive issues with chatbot due to anonymity it offers. It's like it can be a very sensitive issue, like even sexual part or sexual issues or any other private area. So if that particular person is disclosing the same with the individual counselor or psychologist or any other person who is really helping them, could be more effective than the person. And this chatbot really helps to overcome all these. Um, Private area. It helps in privacy. It can encourage people who might be like hesitant or reluctant to seek help to open up their struggles. See, in individuals, sometimes in my clinic also, I observe they may have some resistance, of course, struggles and reluctance to open up their thoughts. So, in such case, chatbots will help them a lot. And active listening and validation. So chatbots use natural languages processing algorithm, and of course there are so many languages in artificial intelligence chatbots. So the individual can choose the language as they like or the vernacular language which they want, and based on that they can engage in conversation with the users. Of course, offering active listening, validation, and the validation is nothing but accuracy of information and empathetic responses. While they are not a substitute for next slide, please. Next slide. Next slide also, please. Yeah. So validation and empathetic responses, and they're not a substitute for human interaction. As of course, before we had an argument, whether face-to-face confrontation would really help out rather than chatbots. As I agree 100% because I'm a counselor. So face-to-face contact and interaction and eye contact, body language, of course, all those things really plays a vital role and major role in all crisis intervention. But still, this chatbot is also helping out. Okay. And it is no more a substitute for human interaction. Yes, of course. Next slide, please. And safety protocols. So crisis chatbots are often equipped with safety protocols that allow them to escalate the conversation to human crisis responder or emergency services if the user is in immediate danger. So some of the safety protocols they can really follow. And next is like digital mental health platforms. So number one can be like accessibility. So everybody can access, like even a kid to old age can access. So like digital mental health platforms, including apps, websites, it makes mental health resources and intervention accessible to a wide range of individuals. And of course, is especially beneficial for those who have limited access to traditional in-person services. Next slide, please. Yeah, self-help resources. So in digital mental health, so first pointers like self-help resources, it includes like relaxation technique. You all know, like in this current stressful world, of course, stress vaccine will come in the schedule. No, it's nothing to wonder. No more wonder. No more magic. So after 10 years, we all will have stress vaccine, like you and me. So for simply just to tell, I would like to talk about here is a relaxation technique. So relaxation technique can be like deep breathing or even Jacobson's progressive muscle relaxation. At present, we have modified Jacobson's progressive muscle relaxation technique, and even listening to music or even a dance therapy, of course, guided imaginary or meditation. So a person can just sit comfortably, and of course, a therapist will guide them that as if they're going to simply a good place or beach or park or some other pleasant place which they really imagine. And cognitive behavior exercises. Cognitive behavior exercises, it usually involves like active problem solving. See, person may come with problem, they may not identify their own problem. That's a big problem for them. So they will think only the problem, or they may not know what is the problem. So we'll make them to identify the problem and we'll make them to solve the problem by themselves. That is one point in cognitive behavioral exercise. And number two, I could say, is like reconstructing thoughts. Yes, we restructure the thoughts also, because all negative thoughts will be replaced by positive thoughts. And of course, we'll schedule activities like morning till they get from the bed and get up from the bed and still they're going to bed. Like morning 6 to evening 10, night 10, we just make schedule like Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. We make schedule for them, and they'll follow the scheduled activity and they'll practice it regularly. So, and unless see, there is a proverb you all know: idle mind is devil's workshop. So that should not happen. So that's why we schedule all the activity. And of course, next in cognitive behavioral activity, one more I could remember is practicing mindful meditation. We all know, we all make the client to practice mindful meditation. And next is like relaxation. Yes, we make them to relax. And at present, we have a mission called biofeedback. No, previous slide. Still previous slide. Previous slide, please. Yeah. Previous slide. Don't scroll, please. Next slide. Yeah. Next slide. Something went wrong. Yeah. So, please. Sorry, somebody's manipulating there. Previous slide, please. Previous slide. Don't move. Previous slide. Previous. Yeah. Sure. Please stop. Next slide. Please stop with this. I'll just explain. Something went wrong, Gezel. Gezel, can you hear me now?
Yeah, definitely, doctor. It might be a technical problem. I'm sorry. Yeah. Is this the slide you were asking for?
No, not this one.
Okay, previous than this.
Yeah, please move. Previous. even previous.
Okay.
Previous. Yes. Yeah, stop with this slide only. Yeah, this slide. Same slide.
Okay.
Yeah, thank you. Thank you so much. So one more point, I was talking about like practicing mindful meditation and relaxation and breathing exercise. So everything is science. So if you could practice like mindful meditation, endorphins will be released in the blood. Of course, all stress will be relieved. And relaxation and breathing and all, it enhances the oxygen supply in the lung, of course, to the whole body, cells and tissues. So it keeps a man fit and healthy. Of course, immune system will be boosted up, and they're taught, and of course their higher mental functions like thinking process, even like attention, concentration, memory, abstract thinking, concrete thinking, judgment, decision making, even intelligence level, emotional level, everything will be enhanced. And next could be like mood tracking. See, in therapeutic intervention, there is an excellent point called mood tracking. See, in mood tracking, we can track where the person is with the help of like GPS or even chatbot or artificial intelligence. No wonder that at present we can track the mood of a client or a person where they stay. It is a tool actually. It is used to keep a record of a person's mood at regular intervals. It can be like regular interval, like morning how he feels, like at mid morning how he is, and after half an hour how he is, and afternoon, of course, evening, night, and how his mood has been regulated on and off. Everything can be tracked with the help of this chatbot. So from here I can even track Gezel's mood or any other person in this conference. So it's also a wonderful method, like tracking mood. Of course, journaling whatever the feeling they are really having, they can just write it down. And chatbot can even analyze, digital mental health can even analyze. And of course we use some of the exposure therapy exercises also. And like intervention, it helps to help user manager their symptoms and develop coping strategies. Next slide please. Next slide. Yeah. So remote therapy and even teletherapy. So here it's a very good health platform, and here they'll give connections to the therapist like through video call, or with the help of texting messages. And it is highly good and easy to access also, and it is really a very comfort zone for the client who's really seeking help of mental professionals. So in this way it is really helpful, this artificial intelligence, of course chatbot, crisis chatbot, and of course even this teletherapy. Next is like data driven insights. Some platforms use data analysis to provide user with insights into their mental health platforms and trends. It can help users gain better understanding to their emotional well-being and identity potential triggers. Yes, everything is purely data based. Since it is artificial intelligence, everything has been fed previously. So if a person is really having sad mood, it can sense the sad mood. It can tell some solutions for that sad mood, how to overcome that sadness. So these are all some of the data-driven insights. Next slide, please. Yeah, some of the challenges and consideration. See, number one can be ethical concern. So privacy, confidentiality, and ethical considerations are important when developing and implementing digital mental health tools. So ensuring that user data is protected and that interventions are evidence-based is crucial. Yeah, but still confidentiality, privacy is highly maintained in this digital platform, I could say, because when a person is disclosing to a counselor, the counselor is also having feelings. So automatically, unknowingly or knowingly, deliberately or unintentionally or intentionally, These counselors may disclose this, some confidential matters to others. So that is one of the challenges and considerations here. Next slide, please. Next slide. Yeah, personalization. So in personalization, it can be like tailoring intervention. So I would like to add one more point here. Tailoring intervention in the sense, it's like need, based on need of the individual, or it can be delivered. This digital mental health can really deliver as per the individual needs. So, see, if a person is not sleeping well, one may be because of actual depression, and one may be because of the environment. So this environment client should be taking care of the conducive environment, and this depressive client should be taking care of the depressive mood. So that need can be tailored with the help of this digital sensing instrument or AI chatbots. Next, cultural sensitivity. So irrespective of any culture, there is no difference. Of course, it can ensure that interventions are sensitive to diverse population. It doesn't know caste, creed, religion, etc., etc. Okay. Next slide. Yeah, with this, one more slide. Okay. So next is like balancing technology and human interaction. So while digital tools offer convenience, they should not replace the value of human connection. Yes, as per the previous statement, I would like to say here is human connection is totally different. Our touch, our feel, our face-to-face eye contact, of course, body language, gesture, posture, everything is very, everything matters also. And many users may still benefit from Facebook. This crisis chatbots and digital mental platforms have the potential to extend the reach of mental health support, reduce stigma, and provide resources to individuals in need. As with this, I'm just concluding my topic. And of course, any queries can be asked right now. Thank you so much for giving me this opportunity. Thank you, Gesel. Thank you so much.
Thank you so much to Dr. Sampoornam for sharing how chatbots might be helpful for the mental health crisis. It was very informative. So, and yeah, sorry for the interruption earlier. That was an error. All right, let me ask if we are having any questions from Dr. Sampoornam. Dear listeners, you can come up with your questions now. If you are having any questions, you can come up with your questions now in the comment section. For those who are joining us from the LinkedIn Live. Thank you so much on the behalf of Dr. Sampoornam for all those who are sending appreciations and compliments to Dr. Sampoornam on LinkedIn Live. Okay, somebody, it's Anwar Hussain is asking, can you suggest any app for such helps? Dr. Sampoornam.
Chatbot, as I can answer this question. Chatbot is a tool, it's an instrument. So it is just like and it has its own design. It can be like a cat, small cat, or it has its own shape. So everything is minute, chip, everything is uploaded. If you want to ask anything, it itself can give answer. You should buy chatbot first. I don't know the cost of chatbot. So many companies in India are really releasing chatbot every day. They just produce or manufacture chatbots. So of course we are importing and exporting It's a big transaction between country to country. Of course, it is international also. So you can just buy chatbot. It is highly useful, and for any mental health issues, you can use it. In that itself, you'll have all apps.
Thank you for taking the question, Dr. Sampoornam. Yes, Mr. Anwar, it is an instrument. Thank you for the question. Okay. There is one more question in the chat box from Mr. Ahmed Vail.
Yes, I can answer this question also. It's very practical question, very good question. So if a person is illiterate, so what to do? If a person is illiterate, we do have many helpline and hotline numbers, especially helpline numbers for even suicide crisis or simple crisis or any grief. If you can just put in Google and simply you can interact. That's it. There is no need of chatbot or artificial intelligence or digital mental health. Just like that, you can make a call. Even a small 1-year-old kid can make call. So you can make call and you can have some deliverance from that particular crisis.
Perfectly answered. Thank you for the question, Mr. Vail. Any other question from any of our other speaker attendees? Also from the viewers of our LinkedIn Live. There's a condition. Something Meghna wants to know. Hello, Dr. Sampoornam.
Yes, I'm here with you.
Yeah. I think Meghna wants to ask you something. It's in the chat box. Should I read it out for you?
Yeah, please.
Okay. So Meghna is asking about a query. She says everything has its own advantage and disadvantages. May she know the drawbacks of chatbot therapy than face-to-face?
Yeah, it's again a big debate. And really speaking, face-to-face interaction and confrontation is really a great help for the client comparatively to this chatbot and artificial intelligence. Yes, I agree as a counselor. And number two is cost. Cost also, it also matters. And number three can be like illiterate. Those who are really illiterate cannot access all these chatbot artificial intelligence. We all know that. So that could be one more point to be added here. And the thing is, the big plus or advantage I could call, number one is like anywhere can be therapist or the what to say, like chatbot can be carried anywhere. Anywhere it can give solution at any place, any time. So that is a big plus. So that I could add here. Thank you.
Thank you for the question, Meghna. Thank you for addressing the question, Dr. Sampoornam. And one more thing, if you're asking the question, it's not necessary that you have to just ask the question. The question was to be asked in the chat box only when the talk is going on, so that we don't interrupt the speaker, right? So afterwards, you can simply come up on your screen, unmute yourself and ask the question yourself, right? It's better to interact this way. As Dr. Sampoornam is one of our OCM also, and she will keep on joining our event and guiding us in future also. So it's better. and with other speakers also, of course. It's better to know yourselves, be comfortable so you can learn better in a comfortable manner. Right? So if we have any more questions, any other questions? There is question on the LinkedIn Live, Dr. Sampoornam. Mr. Hussain is asking if this instrument is available online or in any store. Hello.
Hello. Yeah. It's available in the market. Especially to my knowledge, this chatbot is highly used in sensitive issues like any sexual areas, any private area. If they want to disclose, they use in many foreign countries. And number two, for psychoeducation, because no nurses and psychologists, they take up psychoeducation. Chatbot itself can give psychoeducation. So it is available. Yeah, thank you.
Thank you, doctor. All right, we will keep on asking the questions and getting the answers from our speakers, but I think it's the time to move forward. Shall we move forward, Dr. Sampoornam, to our next speaker?
Yeah, yes, of course, Gazel. Thank you.
Thank you so much. All right, everyone, our next speaker will be Mrs. Aparna Jishnu. She will be presenting the talk on the title Cognitive and Behavioral Disorder in Parkinson's Disease. I've shared the talk title here. Please
Hi,
take your time.
Yeah.
Sorry.
Yeah, good evening all. First of all, I'm introduce myself. Myself is Aparna, and I am presently BSc Nursing graduate, and I'm pursuing my MBA in Healthcare Management from the Lincoln University, Malaysia. And I'm currently working in Tawam Hospital as a senior staff nurse and a team lead in post-operative care unit. It belongs to the SEHA. And I'm here to present a very short topic about the cognitive and behavioral problems in Parkinson's disease. And this is, first of all, my first presentation in the this live conference. So I will start now.
Definitely. Welcome to Mrs. Aparna. And thank you for the introduction.
Thank you, dear. Thank you. I'll move on. And first, I will just introduce about the what is the Parkinson's disease, what it means.
I'm sorry for the interruption.
Yeah, sure, dear.
Yeah, Mrs. Aparna.
Yeah.
But can you please play the slide like on the full screen?
Yeah, sure.
This is for the better visibility. Right?
Yeah, sure, dear. Yeah.
Perfect. All the very best to you.
Yeah. Okay, I will move to the introduction part. I will just talk about what is about the Parkinson's disease. And it is a progressive nervous system disorder that affects the movement. These symptoms start gradually, sometimes starting with a barely noticeable tremor in just one hand. That means first it is starting within the one hand and then it will be gradually progress. These tremors are commonly seen in this particular disease, but the disorder also commonly causes stiffness or slowing of movement. And the Parkinson disease, just show in the picture, you can see the typical appearance of the Parkinson disease. What are the main symptoms? It is showing like that. There is stooped posture for the person that is happening. Stooped posture means the shoulders become stooped or rounded, and masked facial expression like rigidity, flexed elbows and wrist, and forward tilt of trunk and reduced arm swinging, slightly flexed hips and knees, trembling of extremities, and shuffling, short-stepped gait. These are the main typical appearance of a Parkinson affected person. And this is a chronic progressive neurodegenerative disorder characterized by slowness in the initiation and execution of the movement, that is bradykinesia. These persons usually occur this type of symptoms and increase muscle tone and tremor at rest and gait changes also. These are the main characteristics while happening for a patient got Parkinson's disease. And I will move to the epidemiology. This Parkinson disease, which was first described in an essay on the shaking palsy in 1817 by a London physician, James Parkinson, has probably existed for thousands of years. It came to our India, the crude age-adjusted prevalence rate of Parkinson's disease per 1 lakh population is 14 in northern India, while 27 in the south and 16 in the east, while it is 363 for Parsis in Mumbai. Parsi means some Persians who emigrated to India at that time. And what are the etiology? The main etiologies, the exact cause is unknown. Actually, for this Parkinson disease, we cannot identify the exact cause. And the second one is heredity. Due to heredity, we can, some people's that are happening, they are affecting this Parkinson disease. And family history, having one or more close relatives with the disease increasing the rise of getting. And advancing age, mainly above 60 years. And the sex, male are more likely to get than female. Usually more, they're affecting the male people. And low estrogen level. Mostly the menopausal women who don't use hormone replacement therapy are more risk of getting this disease. And head injury and agricultural work. That means mainly exposure to environmental toxins such as pesticide and herbicides. These are the main etiology which will affect the Parkinson's disease. And pathophysiology, this I will just, what are the pathophysiology behind this particular disease? First, for this disease, first the degeneration of the dopamine producing neurons in the substantia nigra of the midbrain. That means the degeneration of the dopamine, it will happen. Then this one, it disrupts the normal balance between the dopamine and acetylcholine in the basal ganglia. It will affect the normal balance and then impaired extrapyramidal tract controlling. It will lead to the loss of motor control and this tremor, rigidity, and akinesia. These are the main symptoms that happen in the Parkinson disease that I explained earlier. Then the clinical manifestation, first is rigidity. The rigidity means it is an increased resistance to the passive motion. The particular word is cogwheel rigidity. You can see that particular type of rigidity that will happen in the Parkinson disease. What is the cogwheel rigidity means? It is a jerky ratchet-like resistance to passive movement and muscles alternately tense and relax. You can see the way that hand will be. It is a jerky ratchet-like resistance to passive movement. And the tremor, it will be involuntary oscillation of body part. Tremor, it is a particular word that is Parkinsonian tremor is happening in this Parkinson disease. It is described as a resting tremor, as it is typically present at rest and disappears with the voluntary movement. So it describes about the Parkinsonian tremor and manifests as pill rolling tremor of hand. You can see the finger that is like pill rolling. It will happen, not usually, it is pill rolling. And akinesia. Akinesia means it is absence of movement. The movements of freezing may occur and are characterized by a sudden break or block in the movement. That is akinesia. Then hypokinesia, even though there is reduced amplitude of the movement. Absence of movement and the reduced amplitude of the movement also will happen. And postural instability. The postural instability is common in this particular patients. The patient may describe being unable to stop themselves from going forward, that is propulsion, or backward, retropulsion. These are the main two characteristics is happening in the Parkinsonism. Next, I will move to the symptoms of Parkinsonism disease. You can see in the picture that is according to the system-wise, there is so many symptoms are showing. First is hypovolemia and the drooling of saliva and low volume speech, dysarthria, problem with swallowing and involuntary flow of saliva, longer time to complete a task. These are this will have mainly related to the cognitive and behavioral problem in the Parkinsonism disease, and stiff face in advanced PD, altered cognitive function, dementia, and disorder of intellectual function. These are the main symptoms that happening in the Parkinson's disease. And you can see according to the system wise in the central that is neurosystem, it is depression, anxiety, decline in intellectual functioning, dizziness or fainting, and lungs, muscular, intestinal, eyes, mouth, skin, and all the systemic disease. Also, we can see in the Parkinson's disease. And we will move to the complications. What are the real complications that can happen in this Parkinson's disease? These include motor symptoms like dyskinesia, dementia, depression, hallucination, psychosis, and dysphagia, malnutrition, aspiration pneumonia, orthostatic hypotension, risk for fall. These are all the motor symptoms which will related to the Parkinson's disease. And the diagnosis, it's based on the clinical feature. What are the clinical features presenting in the patient? According to that diagnosis, clinical features only, we can rule out the diagnosis, and we can use the CT scan or MRI for rule out any secondary cause, and PET scan also to evaluate any levodopa uptake and conversion to dopamine in the corpus striatum. And anti-Parkinson's medication. First, we will move to the medical management. In that, this levodopa, it is the most effective agent and the mainstay of the treatment for controlling the symptom. The first medicine is levodopa. We are using for this anti-Parkinson, used as anti-Parkinson's medication. And the second one is Sinemet. It is a combination of levodopa and carbidopa. This levodopa enters the brain and it converted to dopamine, while carbidopa, it increases its effectiveness and prevents the side effects of levodopa such as nausea and vomiting. The next medical management is dopamine receptor agonist. And these are the drugs that activate or stimulate the dopamine receptors. And there is ergot derivatives like bromocriptine or pergolide, and non-ergot derivatives, ropinirole and pramipexole. These are the other derivatives we are using in this particular disease. And monoamine oxidase inhibitors. These are also we are usually used for this type of patient. It blocks the breakdown of the dopamine and are used primarily to treat motor fluctuation, and it is associated with levodopa treatment. Most commonly used drugs are seligilin and rosagilin. And these are the different types of the drugs and this mechanism of action to the particular drugs. The first one is levodopa, and it is a dopaminergic. The mechanism of action is it converts the dopamine in the basal ganglia. The second one is dopamine receptor agonist, that is ropinirole and pramipexole. Its mechanism of action is it stimulates the dopamine receptors. It will stimulate. And the third one is dopamine agonist, that is amantadine. The particular action is it binds NMDA type glutamate receptors. It increases dopamine release and blocks dopamine reuptake. An anticholinergic, it is a benzotropine. For example, for this anticholinergic is benzotropine. It will block cholinergic receptors, thus helping to balance cholinergic and dopaminergic activity. And antihistamine, that is diphenhydramine, it has anticholinergic effect. And monoamine oxidase inhibitors, the mechanism of action is block breakdown of dopamine. And catechol or methyltransferase inhibitors, its mechanism of action is it will block the COMT and slow the breakdown of levodopa, thus prolonging the action of levodopa. These are the different types of drugs we are using in the particular disease, Parkinson disease, and the mechanism of action to the particular drug. And next we will move to the surgical management. The surgery is very optional when the medicine does not make the symptoms better. That means thalassotomy and deep brain stimulation. These are the two surgeries they are doing for this Parkinson disease. First one is thalassotomy. It is a surgical procedure in which an opening is made into the thalamus. They are made a small hole in the thalamus area to improve the overall brain function. And deep brain stimulation, it means like a pulse generator, a high frequency electrical impulses to the thalamus and block the nerve pathway to control the tremors. And this picture shows it's deep brain stimulation, how they are placing that particular thing. There is a lead placed through the small hole here in the skull. That is an electrode in target area of deep brain. It's under the skin. This lead under the skin they are putting, and implantable pulse generator under the skin. Like this, they are placing this DBS. And it can be used to treat tremors and uncontrollable movements of Parkinson disease. Electrodes are surgically placed in the brain and connected to a neurostimulator. That is a pacemaker device in the chest. And next is the physiotherapy. A combined approach of physical therapy and pharmacological intervention plays a key role in the management of the patient. Sometimes they are using physiotherapy also. Beyond that, like that, they will use both the physical therapy and pharmacological intervention for the management of the patient. And the second one is physical therapist. They are fully aware of the medications that the patient is taking and what are the adverse effects for these medicines. And optimal performance can be expected at peak dosage, whereas the worsening performance is associated with end of dose cycle. That means exercise training, strength training, balance training, and correcting eating impairment. Some of the patients, they are having cognitive and behavioral disorder. These are the training they are providing for the particular patients. And these are the nursing management. What are the nursing management they are doing for the particular PD patient? First one is they will assess the patient. Then they will take the history of symptoms and their effect on functioning, mobility, feeding, and communication and self-care difficulty. They will take the history according to the functioning, patient mobility, patient feeding, and patient communication, and what are the self-care they are doing and they are not doing. Then third one is assess cranial nerves, cerebellar functions, and motor function. They will do the complete assessment for the cranial nerves, cerebellar function, and the motor function, and observe the gait and performance of the activities of the patient. Then they will assess the gait and the activity level of the patient. Then assess speech for any clarity and space, because some patient they are very rarely speaking out, and we cannot clarify that their clarity. We cannot identify what they are talking. And assess for sign of depression. Some patient they are in deep depression, and we will check the signs for the depression also. And we'll assess the family support and assess to the social service. Of course, for this type of patient need family support, and they need the social services also. And again, the nursing assessment in general, masked facial expression, slow or monotonous speech, infrequent linking. These are the general wise we are doing this type of patient. We are taking the history and integumentary, seborrhea, dandruff, angle edema, and cardiovascularly, postural hypertension, gastrointestinal means drooling of saliva, and neurologically, any tremor. We discussed previously that like pill rolling, that is a main type of tremor we are seeing in this type of patient, and later it will move to legs, arms, and face and tongue. And aggravation of the tremor with anxiety, absence in sleep, poor coordination, and cognitive impairment and dementia, impaired postural reflexes. These are all the neurological factors it will affect this type of patient. And musculoskeletal means cogwheel rigidity, that also we seen before, and dysarthria, body kinesia, contractures, stooped for posture, shuffling gait. These are all the related musculoskeletal type symptoms. These are all we will assess whether this patient is having or not to rule out the PD. and possible diagnostic findings, and no specific test if diagnosis only based on history and physical findings and ruling out of other diseases. And next, I will move to the cognitive disorder. What are the cognitive disorders that we will see in this type of patient? First one is attention and concentration problem. And these problems can make it difficult to focus on task for this patient and follow conversation and learn new things. They are deficit to learn new things and to follow the conversations also. And the second one is working memory and executive function problem. In that, it is the ability to hold and manipulate informatives in mind for a short period of time, because they cannot memorize that thing for a long time. And the language problem. Language problem means it may be mild to severe because the clarity wise, or they cannot spell it out. They are trying, but they cannot. And the visuospatial problems means it is a difficulty in judging distances. Sorry. And difficulty with the spatial orientation and difficulty in the visual perception. In these things, they are having a problem. And memory problem also. That means they cannot memorize for a long time. These are the main cognitive disorders we can see in this Parkinson patients. And the behavioral patients, first one is apathy. Apathy means it's a lack of interest or motivation in activities. It's a type of non-common symptom. We can see this type of symptom in Parkinson disease patient. And the second one is agitation. It is a state of restlessness and irritability. Because it will show, they will show that they are having restlessness and irritability like that. And depression, the people usually they are having the depressive stage, and anxiety and psychosis and REM, sleep behavior disorder. It means it is a sleep disorder characterized by loss of muscle atonic. That means they usually got this muscle paralysis during rapid eye movement. That is REM. It is a type of sleep behavior disorder we can see in the Parkinson disease patient. The causes of cognitive and behavioral disorders in Parkinsonism disease patient are not fully understood. They are thought to be due to a combination of factors, including the degeneration of neurons in the brain. This Parkinson disease is caused by death of the neurons in the brain, because the neurons, they are getting degenerating, and then the death of neurons will happen. Then inflammation. It is a process that can damage neurons and contribute to cognitive decline. And oxidative stress. It is a condition in which there is an imbalance between free radicals and antioxidants in the body. And genetics. These are the 4 causes of cognitive and behavioral disorders in Parkinson disease we can see. And once again, I will just conclude the treatment. In the medical treatment, dopamine agonist, anticholinergic, antidepressant. And in the physical therapy, it can help to reduce the risk of fall and injury. And speech therapy, it can help them to express themselves more easily. And occupational therapy, it can help them to maintain their independence and quality of life. And support groups, the society and the family members, they can support the people. They can provide a forum of people with PD and their caregivers to share experience and learn from each other. Through this, we can help the people that affecting the Parkinson's disease. And I will move to the conclusion that first we will see what is the Parkinson disease and what are the symptoms and how we are managing medically, surgically, and physiologically, like we are giving the physiotherapy and medication selection and dosage. This we are giving according to the manifestation and the age of the client and presence of other medical condition. And what are the nurses assessment. And the last one, we see that cognitive and behavioral disorders will happening in the Parkinson's disease patient. Okay. As with this, I am concluding my topic. Any queries you can ask. And thank you for your patience listening. And thank you for the organizing committee and especially Gazelle for giving me an opportunity. Okay, thank you. Thank you all.
Thank you so much, Mrs. Aparna Jishnu. And it was informative talk. Thank you for the talk also. And one more
Thank you,
thing,
dear. Yeah.
Yeah, I'm sorry.
Yes, yeah.
So I was saying that it was not me, but the committee, and one of the member of the committee is Dr. Sampoornam also. So it's the committee who selected you for our upcoming speaker. Yes.
Yeah, thank you, dear. Thank you.
Thank you so much for joining. That is enough for me as for being my side.
Yeah, thank you.
Yeah.
Thank you, ma'am. Thank you so much.
So any questions from Mrs. Aparna Jishnu? Any questions from the meeting room as well as from the LinkedIn Live? If there are any questions, please write down your question. Or to the people, to the attendees who are in the meeting room, they can simply come up on your screen. Yeah, one more thing, Mrs. Aparna. Is it possible for you to come up on the screen? As in the case of Dr. Sampoornam, we sometimes we face some technical issues or the internet connectivity issues. That's why she didn't come up on the screen.
Okay, dear. Okay.
Yeah, I'll be very thankful. This way, I'll be feeling like I'm talking to someone. Otherwise, yeah, after one speech, I feel like I'm talking to the screen. Thank you so much for showing up.
Yeah, thank you, dear. Thank you, ma'am. Thank you.
Such a pretty face. Why were you just hiding behind it?
Okay, it's okay.
Yeah. So let me repeat the question if anybody has any questions to be asked. And also, to all of our other speakers or all the professionals present in the meeting room right now, if you are having any add-ons with any talk, please go ahead. Either raise your hand and just come up on the screens and give add-on to the discussions going on. Right?
Yeah.
There is someone who is asking if the meeting is recorded. Yes, dear, the meeting is recorded and it will be present on LinkedIn and YouTube. Right? So I repeat, if anybody would like to discuss anything or are having any questions to be asked from Mrs. Aparna, please go ahead. Thank you for the compliments we are receiving for Mrs. Aparna on LinkedIn. I'm feeling a need to ask. Yeah, I'm sorry.
No, dear, you can move on.
Thank you.
Yeah.
I'm feeling a need to ask about some more informations like your name, your country name to all the attendees. As I can see, there are some new attendees in the meeting room and in the LinkedIn Live also. So if you haven't shared your name and your country name and your designation, so that
sure.
I can know you and Mrs. Aparna can know you better. Please go ahead and introduce yourself, dear attendees.
Yeah, okay. Myself is Aparna Gopi, and presently I am working in one of the SEHA facility in Abu Dhabi. It's a Tawam hospital, and I'm having 13 years plus experience in both the ICU and post anesthesia care unit. And now I am presently a BSc graduate, and I'm pursuing the MBA degree from the Lincoln University, Malaysia. And now I'm working as a senior staff nurse and team lead in my unit. Okay, I'm from India actually. Okay,
Yeah.
thank you. Thank you all.
That was indeed an Indian name, I
Yeah,
could
sure.
say.
Yeah, thank you. Thank you so much.
Thank you so much for the introduction.
Yeah.
Okay, so it's Mr. Sahil Dumbre from LinkedIn Live is
Mhm.
asking for a little discussion. Is it the discussion you're asking, Mr. Sahil? Please have a word on development of human brain and behavior. He wants to discuss this topic.
Yeah, sure.
Yeah. So can I ask anybody from our speakers, from our attendees to come up and discuss on this topic? Yeah. Is it what you're asking for? Yes. Mr. Sahil wants to have a little discussion about development of human behavior. Sorry, it's human brain and behavior.
Okay.
Yeah. So would you like to start the discussion, Mrs. Aparna?
Yeah, sure.
On the topic that
Yeah.
development of human brain and behavior. Would you like to start the discussion with any particular point?
Yeah, development of human and behavior. Okay. First, I will talk about the development of human behavior. It's a complex process, actually, and it will include the various factors like genetics, environment, and the experiences. And first, I think in the genetics, this our genes, it will play a role in determining our temperament, personality, and our certain behaviors. For example, some people are genetically more likely to be aggressive or anxious than others. And the second thing is environment. The environment in which we grew up, it will affect the major impact on our behavior. Actually, our parents, like our siblings, peers, and teachers, they are all teachers about the world and how to behave in it. But it will also influence our behavioral sector and experience. In that, I will tell you, in that experience, our own experiences that will influence our behavior. For example, what are the things we are seeing, hearing, and what are the things we are doing will have an impact on how we think and act. For example, if you are abused or neglected for a small children, we are more likely to develop problem with aggression or anxiety later in life. Or like criminal people, their situations are like that. While growing up, their attitude will be changed like that. It will. So up to me, these are the three factors will be affecting the people's development of human behavior.
That was a very well start with the three main points. Thank you so much, Mrs. Aparna, for taking up the discussions in a few seconds and starting it. Thank you so much.
Thank you, dear. Thank you.
This is very first time when we are doing this, as somebody just asked for it and we just tried to give the audience.
Okay, no problem. And one more thing, dear, I mentioned my name in the chat box. Actually, there is one correction. So please, once you are issuing the certificate, can you please try to include that one?
Yeah, we will definitely.
Okay, thank you, dear. Thank you so much.
Thank you. So can I ask for some add-ons from our other speakers? Let's start from Dr. Sampoornam.
Okay.
Dr. Sampoornam, would you like to add on any particular point? if I'm audible to you. Hello, Dr. Sampoornam. Am I audible?
Yeah, yes, dear.
Am I audible?
Yes, yes.
It's a technical glitch, I think. Dr. Sampoornam, you seem to be talking, but I can't hear you. There's a network issue again. I guess there is. No problem. We will take it for later as our next speaker is ready.
Okay, okay. Thank you, dear.
Yeah. Thank you so much, Mrs. Aparna.
Yeah,
Please
thank
stay
you.
connected. Yeah, please stay connected. We are having more to go with for
Yeah,
this
sure.
evening. Yeah, thank you.
Okay. Okay, thank you. Thank you.
So let me introduce our third speaker for the day. It's Ms. Yaren Dogan from Turkey. And the title of her talk is Unraveling Schizophrenia, Symptoms, Causes, and Recovery.
Hello, can you hear me?
Hi.
Can you see me?
Perfectly. Hello and welcome, Yaren.
Hello. If you are ready, let's start.
So energetic, ready to go already. That's perfect.
Yeah.
Yeah. Thank you for joining the event today, Yaren.
Mhm.
Yeah. Am I pronouncing your name right? It's Yaren Dogan.
It was so right.
Oh, I'm
Thank you
glad
for
to know
that.
this. Yeah, thank you so much for confirming that. Yeah, I'm pronouncing it right. I'm glad. Yeah, thank you. And you can start with your slides.
Mhm.
Yeah,
So
all the very
let's start.
best.
Thank you. Let's start. Hello, everyone. Today, I'm going to talk about schizophrenia. I am Yaren Dogan. I am the senior student at Biomedical Engineering in Ankara University. And today, I want to inform you about schizophrenia. So let's start. First of all, we should see how our journey will start and end. Our journey will start the biological mechanism of schizophrenia and end up with cognition, social cognition, and functioning. So let's look at the schizophrenia from the neuroscience perspective. Now I would like to introduce the disorder by talking about what's probably the most popular biological explanation for the schizophrenia. And this has been known as the dopamine theory of schizophrenia. Dopamine, as you know, is a brain neurotransmitter that's found throughout the brain. It's often referred as a diffuse modulation neurotransmitter generated down in the areas of the brain stem that project out to the wide region of the neocortex. You don't need to know where these structures are, but just in the general sense, think of these dopaminergic chemicals as going to white sweathearts of the brain. And in the dopamine theory of schizophrenia, the idea has been that elevated levels of dopamine may be responsible for some of the symptoms of schizophrenia. This conclusion has been generated from a couple of important findings. One important finding has been the drugs that reduce positive symptoms, that is, delusions and hallucinations. are drugs that typically block a type of dopamine receptor in the brain known as the D2 receptor. These dopamine receptors, in essence, are blocked by the drug. The drug comes in and blocks this receptor, which is a protein that's attached to brain cell. It blocks receptors, so that dopamine that naturally is transmitted from one cell to another in the brain can no longer operate. It's as if the drug is decreasing the effectiveness of this neurotransmitter in the brain known as dopamine. And as this effectiveness has decreased, dopamine transmission, positive symptoms remit or get better. So this suggests that at least the positive symptoms of the disorder are driven by excess in the dopamine. These D2 receptors that antipsychotic medications block are in fact located in some subcortical areas. They are located in the limbic system. They are located in the striatum. These are two different brain regions. And because of this, a newer model of dopamine theory of schizophrenia has emerged, in which it is shown that there are two systems of the brain neurotransmitter dopamine. One system which is generated in the brain stem project to be limbic system in the striatum, and overactivity in the system leads to delusions and hallucinations. There was also a second dopamine system which emerged from the same area of the brain system, but this system projects out to what's called the prefrontal cortex of the brain, located right and the front of the head. Reduction in dopamine in this system had been shown to lead to the negative symptoms of the disorder. Social withdrawal, blunted effects, alogia, asociality, all these symptoms of negative symptoms that are. So one of the current models now is that dopamine may play an important role in the generation of symptoms in schizophrenia. The oral antipsychotics that reduce positive symptoms appear to work on subcortical targets of the dopamine. Whereas the negative symptoms, social withdrawals, blunted effects, for example, appear to be driven or had been hypnotized to be driven by reductions in dopamine input into the prefrontal cortex of neocortex. So this is thought to be a role of the dopamine in the generation of symptoms in people with schizophrenia. We certainly know that there are structural differences in people who have the schizophrenia. So we know a variety of studies that there are reduced volume measurement in the frontal and temporal lobes of the brain. So in the frontal and temporal lobes of the brain, there is a reduction in the volume when you look at the groups of people with schizophrenia has compared the matched healthy controls. The most powerful structural neuroimaging finding that's been reported, as you can see in the slide, are that the ventricles of the people with schizophrenia are generally enlarged relative to match controls without the diagnosis. Now, I would also make the point that with these studies of the brain structure in people with schizophrenia, it can be a little difficult sometimes to make conclusions, because people have with schizophrenia not only have the disorder of schizophrenia, but they also often have more deprived social circumstances. Their diet may not be good as good the other people's. They deal with the social stress in a way that people without the disorder don't have to deal with, right? They also may have had the birth complications, right? They may have allowed the disorder on to image. They may have effects on the brain to development. So we cannot completely attribute these findings regarding a large ventricle solely to the diagnosis, but it certainly is suggestive evidence that the diagnosis of schizophrenia is in fact associated with a loss of brain tissue that leads to the enlarged ventricles. Now, I want to talk a little bit more about the neuroscience of the disorder, but to move from talking about the neurochemistry of the disorder. So key neurotransmitters such as dopamine that are likely involved in the disorder. And to begin talking about the actual structure of the brain and how that changes in the people who have the schizophrenia. In order to understand the structure of the brain, you, of course, need to know the major landmarks. So I would just like to remind people that we have got 4 major lobes that make up for what are called neocortex, which is the surface on the human brain. And they again consist of the frontal, parietal, temporal, and occipital lobes. These lobes are actually surround a large space, which are known as the ventricles of the brain. There are 4 ventricles of the brain, the lateral ventricles, which are also labeled ventricles 1 and 2, and then ventricles 3 and 4. Ventricles 3 is located around the level of the thalamus, and ventricle 4 is located just below the cerebellum. It's a fluid that bathes in the brain, provides the brain protection, carries important waste production out of the brain, and brings nitrogen to the brain. So you can think of the brain as consists of this overlying neocortex, consists of 4 lobes, a large series of space known as the ventricles, and then a variety of subcortical structures. These ventricles are important because they represent a space in the center of our heads, and we have a fluid that's transmitted through this space called cerebrospinal fluid. The limbic system, amygdala, and hippocampus and basal ganglia involved in the movement, the midbrain and the brainstem and the cerebellum. As we talk about the structure of the brain, I will be talking about a lot about this major sort of large neural structure within the human brain. So, schizophrenia neuroimaging transformed with MRI, leveraging a powerful magnetic field to manipulate hydrogen atoms. Hydrogen atoms prevalent in a water-rich tissue react to the radiofrequency pulse in the MRI. This constant magnetic field and radiofrequency pulse reveal energy absorption and release, indicating water distribution in the brain. This distinction highlights a gray matter from white matter without delving into MRI physics. MRI allows us very detailed, highly detailed structure pictures of the brain. We can see overlying cortical areas very well, and with a less degree of certainty, but still with quite a bit of detail. We can see subcortical structures such as amygdala, the hippocampus, the basal ganglia, and the structures. Over 1,000 controlled studies have examined the brains of individuals with schizophrenia, matched against the health controls in terms of age, gender, education. These studies reveal noteworthy insight. Notably, the prefrontal cortex exhibit around a 5% volume reduction in individuals with schizophrenia compared to health controls. Similar findings are seen in the temporal lobes, showing about a 5% reduction. Subcomponents of these lobes, like the amygdala or major gyrus, may show even more significant differences. Ventricles in individuals with schizophrenia, both lateral and third, there are 20 to 40% larger on average compared to healthy controls. These consistent findings hold true across imaging techniques, including CT scans, structural MRI, and post-mortem analysis. Enlarged ventricles and volume reductions in the key neocortex areas persist. Indications and enlarged basal ganglia are also present, potentially related to antipsychotics medication dosage and frequency. These findings underline the impact of schizophrenia on brain structure across diverse research methods. At this point, we have discussed structural neuroimaging studies, and we will deep into functional neuroimaging. Functional studies are more limited in number, focusing on brain activity rather than its structure. These studies conducted using MRI, like structural studies, measure oxygen levels. Specifically, the blood oxygen level depends, as we know, the Bolt signal. This signal indicates areas of heightened brain activity during cognitive tasks due to increased oxygen supply. Functional neuroimaging has yielded crucial insight into schizophrenia. Attention and working memory are closely examined cognitive domains. Attention encompasses focusing on a specific stimulus or a task while ignoring distractions. Working memory involves short-term retention and manipulation of information, such as recalling and reversing a phone number. Key findings from functional studies revolve around these areas. Attention is assessed through the continuous performance test, as we know, CPT, while working memory is evaluated with tasks like the NBAC test. Continuous performance tests show that individuals tracking a target amid distraction display distinct brain activity. These functional neuroimaging findings offer a valuable insight into how schizophrenia impacts cognitive process. In some cases, it's remembering, for example, to respond to way X whenever the A precedes it. So you can see a series of stimuli and you respond to an X whenever A precedes it. In other versions of the test, you are looking for specific targets, but the stimuli may be degrade visually. So it's hard to detect where the stimuli are. So you are trying to pay attention to these sort of visually degrade stimuli responding when you see the targets. In these types of studies are using continuous performance tasks. Studies have shown quite decisively that one area of the prefrontal cortex, specifically dorsolateral prefrontal cortex is reduced in activation in people with schizophrenia as compared to healthy controls. This findings is particularly powerful because when the finding or the study has been replaced in the first episode samples, people who have just been diagnosed with schizophrenia and have minimal exposure to antipsychiatric medication. These findings are still evidence. That is, when people do this task and they have schizophrenia, their activation in this area of the brain, known as the dorsolateral prefrontal cortex, is reduced. So again, this suggests a close relationship between decrease in brain activity. We had talked about the brain structure. Now we are talking about the activity, but decrease in activity and performance on a specific cognitive task. Now I'm going to talk about the psychology of the disorder and specifically about the different aspects of cognitive functioning, social cognitive functioning, emotional functioning, diffusional beliefs, and some other models of cognitive processing in people with schizophrenia. To start in our discussion of the cognitive, so let's start. We will be focusing on the topic that revolves around the cognitive difficulties in schizophrenia. Schizophrenia is a disorder that significantly impacts cognitive function, and various studies have showcased the breadth of these challenges. To begin, a notable finding is that individuals with schizophrenia often struggle with maintaining focused attention. Research involving continuous performance tasks has revealed that sustained attention is impaired. Similarly, deficits are observed in the episodic memory among these individuals. Episodic memory involves memories that form and fade swiftly, like recalling breakfast details from a couple years ago, and the encoding process, while information is initially processed, tends to be impaired, while storage over time remains relatively intact. Language abilities also come under scrutiny. Deficits in schizophrenia patients' language skills typically range from 1 to 2 standard deviations below those of the matched health controls. Language tasks assessing fluency, like reciting words starting with a certain letter, demonstrate these deficits. Likewise, working memory, distinct from episodic memory, which involves manipulating information for a short period, is an area of noticeable impairments. Working memory tasks like digit sequence tests consistently show deficit within the 1 to 2 standard deviation range. Furthermore, processing speed involving rapid completion of visual motor tasks reveal pronunciation deficits. Some scholars argue that this might be the selective area of the impairment, surpassing other cognitive domains. Sensory ability is another domain affected, with individuals with schizophrenia struggling to detect slight changes in auditory or visual stimuli. A task of a particular interest is the backward masking task, where a stimuli is briefly shown, followed by a masking stimulus. Schizophrenia patients constantly display backward masking effects, even with extending time intervals. This suggests a disruption in fundamental sensory processing. In conclusion, cognitive challenges and schizophrenia span a wide range of domains, persisting despite treatment efforts. Research in these areas plays a crucial role in understanding, very important role in understanding and changing cognitive abilities. In people with schizophrenia, there is a wide range of the cognitive difficulties observed. However, alongside these difficulties, there are a few areas where they seem to perform just as well as healthy individuals. One of these areas, non-declarative memory or skill learning. For instance, if person learns to keep their finger on a stylus as the moves around the disk, their performance improves over time. These tasks don't require consequence recollection, and individual with schizophrenia often perform as well as healthy controls in such tasks. Another area where intact performance is observed is in the experiencing the hedonic or emotional value of stimuli. Positive social interactions or enjoying something like food or drink evoke similar arousal levels and enjoyment in both individuals with schizophrenia and those without the disorder. However, it's theorized that their ability to represent future experiences related to these stimuli might be distributed. Despite the presence of cognitive deficits, some areas of the performance remain intact. Moving on from cognitive difficulties, I would like to discuss closely related difficulties in the social cognition. Social cognition, in short, pertains to how we perceive or interpret our social environment. Unlike cognitive measurement, which focused on clients' performance in this task, like remembering numbers or words, social cognition is more concerned with information processing biases. Stimuli used in these studies often include spaces, social interactions, and other social related causes. Social cognition can be divided into four main categories. The first is effects perception, involving recognizing emotions from the faces or voice tone. The second is social perception, which relates to understanding social rules in specific contexts. The third category is theory of mind, the ability to attribute accurate intentions to others. Lastly, there is attributional style, which concerns how we attribute events to ourselves, others, or the environments. These domains have been well studied in schizophrenia over the past decades, revealing deficits in all the areas of social cognition. Impairments are observed in recognizing emotions on face, understanding social rules, attributing intentions to others, theory of mind, and having an attributional style bias towards attribution to others. In the context of social cognition deficits associated with schizophrenia, there are two main sets of challenges identified. The first involve the basic cognitive functions like attention, memory, sensory perception, and working memory. The second pertains to deficits in social cognition, which include biases in understanding and processing emotions, attributing indentations to others, and interpreting events in the environment. These difficulties are of great interest to researchers because they closely align within the functional impairments often observed in the individual with schizophrenia. Mainly people with schizophrenia struggle with the task like working, forming friendships, and engaging in productive activities due to these cognitive and social cognitive challenges. Functional outcomes in schizophrenia are typically measured through different means. Clinicians assess factors such as the number of friends a person has, their social engagements, community involvement, and employment status. These assessments often supplanted by input from family members or coworkers, help guide an individual's community functioning. Notably, cognitive difficulties strongly correlate with the performance on these clinician-rated measures. Another measure of the process in schizophrenia treatment is the effectiveness of psychological rehabilitation programs. These programs encompass social skills training, cognitive remediation, and employment support interventions. Individuals with more severe cognitive deficits tend to struggle more in benefiting from these interventions. Their cognitive challenges hinder their ability to make the most social skills training, employment supports, and other psychosocial treatments. Research explores the connection between cognitive difficulties, dysfunctional beliefs, and functional outcomes in individuals with schizophrenia. Performance-based measures of everyday tasks, such as rescheduling appointments or planning all things, demonstrate a strong correlation between cognitive challenges and task performance. These findings suggest a close link between cognition and functioning, implying that improving cognitive abilities could change the daily life functioning of individuals with schizophrenia. Social cognitive deficits encompassing attributable style, facial effects recognition, theory of mind, and social perception also play a role in functional outcomes. These deficits are connected to independent living, behavior in psychiatric settings, and community functioning. Both cognitive and social cognitive deficits are significant contributions to functional outcomes, making them prime targets for the future treatment interventions. Dysfunctional beliefs have emerged as an intriguing area of research, particularly in understanding the sources of disability in schizophrenia. Studies have shown that individuals with schizophrenia tend to endorse negative beliefs about themselves and their actions, which can impact their functional outcomes. These beliefs, such as the idea that making a mistake will lead to others thinking less of them, have been found to medicate the relationship between cognitive deficits, negative symptoms, and functional outcomes. This new perspective suggests a cycle process where impaired neural system lead to cognitive deficits in attention, memory, and working memory. These cognitive deficits result in repeated failures, fostering dysfunctional beliefs that reinforce the perception of the impending failure in social interactions and tasks. Consequently, individuals may withdraw from social engagement and avoid new experiences due to perceived inability to success. This integrated model provides insights into the complex interplay between the brain function, cognition, dysfunctional beliefs, and functional outcomes of schizophrenia. And thank you for listening. If you have a question, I want to answer them. Thank you.
Oh, there was so much to learn. I mean, really. Thank you so much, Ms. Yaren, for shedding light on the complex topic with depth and compassion.
Thank you.
So let me ask if anyone from our attendees or from the LinkedIn Live have any questions to ask from you. Dear attendees, dear viewers, you can come up with your questions now. Please note that the LinkedIn Live is delayed by a few seconds from our meeting room. Yeah. So any attendees from here, if you're having any questions, anything you would like to discuss among yourselves.
I think my presentation was so good, so they don't want to ask anything. It was all clear.
It was actually, that's what I said. There was so much to learn, so much to get insights about, you know. That's so positive energies I got from you. I loved it. Absolutely loved it. Okay, words of phrases are for you are coming on the LinkedIn Live as well. Wonderful presentation. Yeah. Thank you so much, dear viewers.
It was my pleasure.
So let me repeat the question. Any question you would like to ask from Ms. Yaren? It was indeed informative. Yeah. All right. There are some of the viewers who might have asked the questions and we can't find in the comments. So I guess the team has provided the discussion portal link. Dear team, please confirm if you have provided the discussion portal link so that they can simply go to that link and write down their question. Yeah, thank you so much. To all the viewers from LinkedIn Live, they can go to our discussion portal and ask their question there. I think it will be helpful. Hello, Patricia. Okay, this is a direct message to me. She Okay, Patricia is asking, will we have a copy of the slides from the presentations, please? So Patricia, it all depends on the speaker, if they want to share the slides or not. Otherwise, we'll be having a recorded presentation on YouTube, on LinkedIn Live. And yes, while we'll be providing the certificates, we will provide the links for it too. As all of our speakers are already in the meeting room, you can ask the speakers if they want to share the slides. That's what I'm saying, everyone, and that please feel free to interact. Yeah. Still the time, we might get some more. Okay, what about certificate? Okay, so the certificates will be provided to all those attendees and participants who registered for the event, right? Yeah. All those who have registered for the event and are joining the meeting will be provided with the certificates. Any more question? Okay, general questions also. Any more question if you're having? While talking about the questions, I might get the response in few seconds or a few seconds later, but there was someone named Miss Neha Ghanshani on LinkedIn Live. She asked the questions, and I'm sorry, dear, I couldn't reach to the questions that time. You asked the questions for Parkinson's disease, yeah, about Parkinson's disease. It was from Mrs. Aparna, I guess. So we will take the question later in the questionnaire session after our fourth talk also. Thank you for your patience. All right, I guess we should move to our fourth talk today, as Miss Lara might need to leave in a few minutes, I guess, as she will be traveling afterwards.
Yes.
Yeah. Hi, Lara.
Hi.
So it's Lara Dinjar.
Yes, yes.
Welcome to the event, Lara.
Thank you.
Yeah. So let me introduce everyone, our fourth speaker, Miss Lara Dinjar from University North Croatia. And the title of her talk will be How Stress and Food Affect on Human Health. Before that, I have a question to ask from all of you. Yeah. So while we are talking about stress and food, let me ask a very basic question. Think about the foods you consume during difficult times or stressful times, right? Do you believe they can help? Or let me make it clear, even simpler. Okay, I'm sorry. There was some questions, I guess. Okay, we will take the questions for Parkinson's after this talk, as the question is directed to Mrs. Aparna, I guess. We will take the questions. Thank you, team. So let me ask, during your stressful time, what do you crave for some particular food, and what that food is? Yeah.
We will see.
Did I ask the
Okay.
right question, Miss Lara?
Yes, people doesn't really know the combination of stress and food. They are really connected, and you will see how and why in this presentation.
Yeah, that's why I asked
Because
for
food really affects the brain, and many people doesn't know that, and now you will learn and see how and why.
I'm really looking forward it. Personally, I'm looking forward to it, to know about what are the reasons. And same, Miss Yaren, I eat a lot too when I'm stressed. I feel hungry in minutes. So yeah.
I'm
What
glad
about
to hear
others?
that.
Yeah. Let us see on the LinkedIn Live also. What are the foods you crave for when you are in stress? Somebody said it's Miss Preetha said reading storybooks. Okay, that's what you crave for.
But I'm interested in what food, so I can explain you why and
Yes,
how.
yes. So in food, we got answers as chocolates,
Yes, most
sweets,
common thing I've heard. Yes, yes.
and
Sugar,
coffee.
fats. Yes,
Okay, some it's Meghana said I don't feel like eating when I feel stress.
yes. That's yes, yes, yes.
Okay. So I guess our message reached a bit late on LinkedIn Live. Okay, there also, chocolate is a common word. Coffee.
Yes. Oh, yes. That you will see why. I have all of that in my presentation.
Perfect.
Yes.
All right then. Let us know in depth.
Okay, first, thank you, and it's honor to be here as a young research student of food science and technology, and to have this opportunity. Firstly, my name is Lara Dinjar from University North from Croatia. I'm a nutritionist and food scientist. I will talk about my research, which title is How Stress and Food Affect on Human Health. So, today, stress is among the leading reasons that are the precursors of all other diseases. But what we really know about stress and how other people really know about stress, what is it? Did your head ever hurt from everything you needed to do that day, but you just didn't have enough motivation, desire, or strength, energy to do it? So you postponed the commitments day by day, and everything has built up for you. So now you're preoccupied with everything because you just didn't get that done when you needed to. So you're feeling bad, but still don't do it. Still don't do anything about that, and you wish you could go back in time, go back again, and you do that day by day as in the first place. Your boss, example, said that you have to take more responsibilities, more tasks, or your kids at home aren't really listening to you. You don't tell others about your problems. You don't open up. You're just aren't in the positive mindset, and your stress is getting higher. Plus, you don't work out. Your diet is poor with vitamins and good vegetables, minerals. Or maybe you have another diseases incoming up and you're feeling it. Your stress is increasing significantly, and you don't know what and how to do next, what is happening to you really, and how to help yourself, who to turn to, who to talk to. Well, you are in the right place now to find out. Here we can see what is stress actually. It's all of that: aches and pains, bad or just no sleep, decreased energy, trouble with concentration, acne, muscle tension, constant headache or migraine, increased anxiety, nervousness, irritability. That is all bad stress. We have bad and good stress, but we will go to that later. So, history. Just as before, man was prepared for extreme conditions to be able to catch an animal, or on the other hand, to escape from it. Stress was also needed there. However, this stress caused susceptibility to the information of blood clots, rapid heartbeat, release of sugar from the liver, release of fat, precisely cholesterol. Blood is drained from other organs, for example, intestines and skin, so that the brain can receive as much blood as possible and fill itself with oxygen. So that is ready for the fight, and certain hormones were secreted that encouraged all of this. However, this all happened in the human organism in the past, but it has remained until today. But the fact that we no longer run away and hunt, but when we do find ourselves in a stressful situation, we don't run away. We can't do that. When and how you will react differently, because today our lives works completely on different way. Today, we don't run away from the animal, but we do run away from our tasks, our problems. We build them up and we don't do them, even though we know we have to do them. Is there just bad stress and bad things about it, or is there something good? When we do have many things to do and little time, we find ourselves doing nothing at the end because we are preoccupied with all of that, and that is common thing what people do. Stress is not always necessarily bad, but unfortunately, we all do that is. We all do is talk about bad stress, and people are using word stress just for the bad things. When we do it too often, our brain stimulates impulse and starts imagining something that doesn't exist because we put the wrong meaning into the word stress. There is also a good stress that encourages us to be productive and pushes us forward, but not many people do know that. We see productive routines on the internet, YouTube, and other platforms such as Instagram and other influencers on the daily basis, but not many of them are true for us. We are humans and we are not robots. We can be productive, but not as some people on the internet show us, that they can be active in everything 24/7. No, that's a lie. The body has stages in which it's productive, and after that, there should be a rest, because without rest, there is no productivity. And this is the harsh reality and the way our body functions. Diseases and mistakes that people do under stress. When our body is constantly under bad stress, low diet with a lack of vitamins and minerals, plus if we do have something of the most common diseases of the 21st century that are anxiety, depression, obesity, migraines, or just the headaches, high blood pressure, diabetes, and many more, our body cannot work normally under that sort of circumstances. But when our body is constantly under bad stress, substances are secreted in the body and processes are accelerated, which result in decreased immune system due to the fact that enormous amounts of good nutrients are consumed due to the body's preparation for some danger automatically from the past. And the digestive system does not work as it should. And all other body systems are out of balance automatically. Many people today suffer from various diseases, be they mental or physical. We have the various amounts of the diseases of the 21st century, and they are one of the most common diseases today, which is even more fueled by stress. And all of them can also be associated with the fact that people today do not eat healthy and exercise very little. This affects the body even worse, and so as human health itself. Some people who are under stress lose their sense of hunger. But some people, when they are under stress, take something to calm themselves down, be it high calorie and fatty foods such as chocolates or chips, something full of sugar or some intoxicants like cigarettes and other stuff, or something else like coffee. But there is another way. This don't need to be your way to calm down. The body can change, and your stuff to calm yourself down doesn't need to be this. Is there help for stress? Yes and no. Sometimes there is acute stress that can still be resolved if appropriate measures are taken in time. Acute stress don't turn into chronic stress. We don't want to acute stress turn into chronic. Chronic stress, that is a more serious form and makes difficult for people in their daily basis now. In order not to reach their this chronic form, it is necessary to take certain measures. First and foremost, we should look at nutrition and how properly and regularly we eat what food and in what quantities we take it into our body, just like vitamins, supplements, and etc. While some supplements can help us with all of this, some medications makes up for us. But it is not just food, it is whole way we live. We need to sit down and see what is bothering us the most, because if you do not put yourself into the first place and really wanting to help yourself, you can't change yourself. You can change your diet, you can change your lifestyle, but if you don't change your mindset, you will do nothing, because our brain is the most powerful thing in our body. Without the brain, all of our functions are disabled. But if you do really want to help yourself, if you have the problem with your diet, because this is the one of the biggest problems today, you can help yourself and search help from the experts. For example, the stress causes a lack of vitamin C, zinc, and vitamin B complex. Food, vitamins, and minerals to lower stress. Yes, there is. The food is always the healthiest option, but some supplements can help us with all of this. Food rich in vitamin C, B complex, and zinc have a very beneficial effect on stress in our body. Example, they lower stress. And for example, we can find vitamin B and magnesium in whole grain pasta, rice, oatmeal, leguminous, potatoes, green vegetables, fresh and dried fruit, sprouts, eggs, grains, dairy products, seafood, nuts, poultry, lean meat, and they all help us. You can see how various amounts of food that is. You can find something for yourself, I'm sure. Magnesium is good to help our muscles and nerves to work properly, to keep blood pressure and sugar at right normal level, and to help regenerate our muscles, make proteins. But if you have low levels of magnesium, that can cause also a low calcium and potassium levels. So you need it, because it's also releases stress, because magnesium works with nerves, and they are important for normal function for our body and decreasing stress. Vitamin B, potassium, and magnesium can be even found in banana. And I think most of the people loves to eat banana. Okay, something. Okay, supplements. So zinc protects us against infections. It's found in red dairy products, in red meat, dairy products, egg yolks, whole grain products, seafood, and they all are strengthening nerves and heart, so as reduces cholesterol. And for reducing cholesterol and bad cholesterol, walnuts can help us too. With that, these foods only will help us even more. But of course, People who have various other diseases should be careful and adapt their diet to themselves, but not by themselves. The specialist, the nutritionist, should do that for them. So we can see supplements plus food equals healthy and normal function muscles. Caffeine, antibiotics, and probiotics. Supplements, example dietary supplements, can be additional and just additional for our body. Why? Because if we use just supplements and not using the right food, we will do nothing, equals nothing. Why? Dietary supplements can be for additional use if the person knows what to do and knows that he will not be able to take in enough magnesium for his daily intake with their food. For example, the person previously had some more intense thing that help him release his stress, but the muscles will be exhausted. So magnesium supplement is not far away, but it cannot be the main source for the body. As for the absorption of magnesium supplements and food containing magnesium, it is not even close to similar, and you can see for yourself. For example, you come home after a long day of work or a long hike or intense training and drink just supplement. Please remember, a supplement, it will not work without adequate food, while on the other hand, not all supplements are the same. There is really a lot of everything on the market and on the internet today, but you don't need to know how to recognize them, but you need to know which person to consult if you're not sure about something, if you don't understand something for supplements. You will need to consult with experts to do the right thing. If you don't know what and how to do it, just ask. Don't do something at your own risk. Antibiotics and chocolates. On the other hand, supplements are just additional help, and various medicines are, but not all of them are helping us to reduce stress. For example, some drugs and tablets can have caffeine in their composition. And I think that we all know what that is, because caffeine is globally recognizable, because almost everyone loves and takes coffee in the morning, but caffeine is so bad for stress and anxiety and sometimes migraines, and people should be avoiding it. But on the other hand, we have so much worse, and that is antibiotics. Antibiotics are a real problem for us. When we want to get rid the stress, antibiotics reduce and destroy, of course, depending on the strength and of the drug and the dose, but however, they still destroy our cells, our good cells, and the bad ones, of course. The probiotics beyond that are good bacteria found here in our intestines, but they are also responsible for our immune system because of the way they act. What they do, you ask, if you don't know. They are good bacteria that can be found in yogurt, kefir, kombucha, pickles, and fermented food. And if we are under bad stress, which is already damaged us and our body, we really need to use probiotics with antibiotics to help ourselves even a little bit. Therefore, when taking antibiotics, because we sometimes really needed it, which has increased significantly in the last few years, we know coronavirus, etc., we should take additional probiotics through food in order to preserve the immunity, the immune system as much as we can, because if our immune system is already impaired due to stress and we damaged it again with antibiotics, the door begins to open in our body for other possible diseases that we can attract just when we do not specifically need it. Small children and the elderly are more susceptible to developing the diseases, and getting a child to drink medicine is a pain in itself. How do I know it? Here are some research. I will explain it later. How do I know it? I may not have my own children, but I had little siblings that are not a little anymore, and cousins. All of them hated to drink antibiotics because here in Croatia they were usually antibiotics in the form of the syrup, which small children do not like at all. But then I thought and remembered, why don't we put antibiotics in chocolate, be it dark or milk, in small quantities? It works great on human health. It is easy to use and almost all children love it. It has a beneficial effect on the immune system, nervous system, and digestive system. And I think it will be a great idea that could be turned into reality. For now, parents and grandparents showed quite a lot of interest in surveys in Croatia that I will show you. Therefore, everything can be designed. As this idea came up to me, there is so much that can be improved, but I think that with small steps, it will help you a lot. You just have to want enough to help yourself and your loved ones, put in a little effort, and I guarantee that everything will get better. And if you don't believe it, try introducing small changes into your daily life, and I guarantee that you will never go back to the old ways. And how I know it, I tried it myself. But you're asking yourself how chocolate will and can help us. The experts and doctors are saying that the chocolate is bad because it contains so much sugar and fat, but no. It's in the dose, small doses of everything, even of poison. So especially chocolate can't hurt us. Chocolate have a lot of beneficial for our health. For example, especially the dark chocolate is the source of antioxidants. It lowers our risk of heart disease, which is higher because the stress, and keeps cholesterol levels at low level, because when we are on stress, our bad cholesterol levels are higher. It regulates the blood pressure, prevents and lowers the risk of blood clots, and takes many advances in memory and brain function. Because of that, the scientists, and when we are studying on or doing something, we are craving the chocolate, because our brains, the most powerful and the main source of energy is sugar. And we can't, the brain can't live sugar. We just can't get rid of them. Some specialists and nutrition on Instagram I saw, they are saying the chocolate is bad, blah, blah, blah. It's not. It's just the dose. So the fat clogs our pores, the fats, not sugar. Cocoa powder is good for all of this. So this, we can see this just for women, but sugar and chocolate cravings, when we have our menstruation period, it's for the right reason, because dark chocolate helps us with hormones and pain. So dark chocolate, you can see it has many benefits. It has good nutrition table, but you can see it's healthy just at the right dose. So you can see the right dose can help us, and wrong will kill us. So it's manageable. You don't really need to cut anything in your diet, except if you're restricted at that food because of some disease. But on the other hand, you can eat all of that, be happy, productive, and live a healthy life. So we can see our research. This is Croatia. The parents said that their children were prefer to use antibiotics in the form of chocolate, and in which form prefer parents for their children to use antibiotics are syrup. So you will see it's halfway there, but antibiotics are used for children for now. I'm talking about for now. So children were prepared the chocolate. So like I said, and the parents said that the children doesn't want to get antibiotics right now when they tell them. They have to animate them, use antibiotics, I will give you this, go there, because kids don't love it. Kids prefer chocolate. And we here can see they prefer the milk chocolate, but some kids eat all the possible ways of chocolates. And at the end, like I said, right dose can help us and wrong will kill us. So you can eat. Be happy, productive, and live a healthy life. And thank you for your nerves. Questions, if you have some questions, you can ask now, or if you want to talk to me later, you can ask at my email, ladinjar@gmail.com. And that's all of me. Thank you, everyone.
It was a great presentation, Ms. Lara.
Thank you.
And definitely, I'm never gonna stop when I crave for chocolates and coffees now.
Yes.
Thanks to you.
But you should the dose.
Yeah, the dose. I'll
Yes.
take a track of that too. Not much. It should not be much, right?
Yes, yes, you're right.
So any questions from any of our attendees or our viewers on LinkedIn? Any questions? And I hope many of you got the answers of your why do you crave for such things and what you should do with the cravings then.
Many people do after this, yes.
Yes, exactly. Any questions from any attendee or any viewer of us? Words of appreciation from LinkedIn as well. Thank you. Okay, as we are done for 4 of our talks right now, so we can go for the questionnaire session from Lara, or Miss Lara as well, of course.
Okay.
Yeah. All the thank yous we are getting from our live stream. Welcome to all of you, and it's our pleasure. You can come up with your questions. Okay, there's our very first question. Meghna, you can simply come up on the screen or unmute yourself and ask the question. It is allowed, trust me. So Meghna is asked. Yeah, I'm sorry. So let me ask the question. Is it normal if a person doesn't feel like eating? How to manage it?
At sometimes, yes, it's normal when we have some parts of our life, year, month, that we eat more and we eat less. It depends of everything, how much stress we're at. I don't know, about everything. About is it outside raining? Is it outside sunny? Is it outside winter or summer? It depends of everything. And that is normal, but not, I have that too, but it's not normal if it's longer than, I don't know, week. If the person stops eating anything or just lives on the water. And I know that the teenagers do that very often. I have one teenage sister at home and I know everything about that, but it's not normal. You should consult with that person, or if it's that about you, you can consult with your doctor or someone, but you can't stay without food, any food, longer than 3 days. Longer than 3 days, we don't normally do that. And we have diets like fasting diets and using antioxidants and some stuff to microbiome who is in our body that is bad. We with some substances put, I don't know how to describe it, because I have information that is with so no, I will not go into details so much. No, it is not if it's longer than 3 days. No, go to doctor then. But I know that we have that periods of time.
The way to manage it is consult a doctor after 3 days, according to you.
Yes.
So, yeah, there's one more sign that we crave food more in winters. Like we feel hungry very fast in winters. We eat much, and in summers, of course, for staying hydration purposes, we crave the liquids more in summers.
Yes, because it's hot outside and our body temperature in the summer it's higher than normal, and the food cravings are when the body is in normal state of form, when their ideal situation for our body, and we can eat more than when we are happy and not under stress or some mental illness. We will eat more. That is just normal, but we eat less when it's something bothering us. Or on the other hand, we can eat more when is something bothering us, but that is another sort of problem.
That is my case. When I'm extremely happy, I don't eat much. I don't feel hungry at all.
Yes, yes.
It happens. So there's one more thing somebody wants to ask, that as you said, there is a positive stress and a negative stress.
Yes.
Right? So what are the usual cravings in the positive as well as in the negative stress?
Positive stress is actually adrenaline, motivation, and so it doesn't have specifically some food that we are craving. Just when we are bad mood, bad stress, then we are so hungry or not eating at all. But when we are hyped and motivational, and when we are at good stress, adrenaline, I don't know if someone is craving something. The scientists aren't really goes in that sort of stress really deep nowadays. Nowadays are more on bad stress.
Yeah. Yeah,
Unfortunately, but yes.
yeah, I noticed that too. I mean, I didn't take a note of it earlier, but now when I think of it, yeah, you're right. We got to know about negative stress more
Yes,
rather than the
yes.
positive stress. We
Unfortunately.
yeah, we have got a name for that positive stress, I guess. It's motivation,
Yes,
the encouragement.
exactly. Yes.
Yeah, they call it that.
Adrenaline, motivation, and the bad stress is the lack of all of that.
Exactly. So, any more questions you'd like to ask from our Miss Lara? I must say the topic was basic, but not so basic as it was basic to got questions from it, but the answers we got, the detailing, as we got into the detailings more, it nowhere left us in the basic stage.
Yes,
Anymore.
I connected
Yeah.
all of that, the physical
Yeah.
state, the mindset, the stress, the body, the health, all of that in
Yeah.
one section.
Yeah, recently I saw a patient who crave the soda drinks more. You see?
Yes, it has people, because it's lacking something. It is because of that. And I saw a person on YouTube videos that is eating, I don't know, the walls, and because it's lack of minerals and vitamins, and the body is lacking of all of that. And the person can be having a lot of weird cravings when we are lacking some food minerals and vitamins.
Exactly. There is one more case we can take into consideration, when the kids, I don't know if it happens in your country, but in India, it is very common, and they give it a reason, the mothers, babies, the little babies, infants, they are sometimes into eating soil or
Yes, yes,
anything related to
normal
soil.
for
Yeah.
all children. And the sand, soil, yes,
Yeah.
it's normal, but we do not need to take our babies and children and say to them, don't do that, because they need to do that because they will strengthen their immune system. And later, when they are not living in the so sterile household, they will get so much more better immune system than the other children that were picked up from the ground and said, don't do that. No, you need to put your children down and do whatever they want. If they want to put soil in their mouth, do them.
That's great. And we need to send the message, your message to the mothers.
Yes, yes.
Yeah, because many of them are stopping their kids. Don't do
I
this,
know.
don't do
Yeah.
that.
That's
Yeah.
common thing that mothers do because they're just like that.
Care, the care by birth, I mean. Okay. There's I got a notification. So let me ask, dear team, do we have more questions from the LinkedIn? Any add-ons from any of you? Okay, thank you.
Thank
So
you.
these were the questions I got for Miss Lara. Thank you so much for the presentation.
you.
It was indeed helpful.
Thank you very much.
Thank you so much. So now we will proceed to our questionnaire session. Before that, let me ask some of our members if they joined the meeting. It's Mr. C.N. Borrell. Yeah. Come on, if you have any questions, you can simply ask it. Patricia Rafiq, Albert Muraya, Alexandra Janikova. Mr. Bert Martinez. Do we have any questions? And if not, we have recorded some questions which we got from LinkedIn. Dear team, is it possible for us to get those questions from the LinkedIn sessions, LinkedIn live stream into the meeting room now? Also, we provided that direct discussion link also. We don't want anyone to miss out from getting their answers. Okay, there are questions. Okay, the question is from Neha Ghanshani. Miss Lara, the question is from you. I'm sorry, I couldn't get the question earlier. I mean, I guess the reason was same, that the live stream is a few seconds late than our meeting room. Miss Lara, do we still have you with us? I guess Miss Lara has left. She already told me that she will be going to take her medicines and pack up as she's going to travel now. I'll definitely try my best to get the answers to you by sending the questions in the discussion portal, and we will definitely ask Miss Lara to answer the questions in the chat in the discussion portal itself. Thank you for the questions from Ms. Lara. From our other speakers, if you are having any questions, please ask. Okay, there are more questions from Ms. Lara. I'll definitely take a note of it. Thank you so much for asking the questions. Do we have Dr. Sampoornam with us? Connected. Is the connection all right? The network connection. Dr. Sampoornam? I'm saying this because I think Dr. Sampoornam is just the right person to discuss these questions, as I believe she can provide the answers right now. And even if not, we can try for it once. Hello, Dr. Sampoornam. Am I audible to you?
Giselle, can you hear me?
Yes, doctor. Clearly.
Yeah, please. What's the question?
I'm sorry, I am asking you the question in between, and thank you so much for joining again, coming up
It's
again.
all right. It's all right. What's the question?
Yeah, I'm sorry. The question is from Miss Lara, but I think you can answer the questions.
Yeah, please.
Will you please? Yeah, thank you so much for giving it a try. Okay, so the question is from Neha Ghanshani. So she's asking, can you delve into the intricate connection between the brain and the gut, especially regarding how stress and dietary factors influence this axis and impact overall health?
Yeah, fine. So the answer is, first, the thing is, you should understand about the connection between brain and gut. See, anatomically, functionally, there is connection called between brain and gut. There is one connection called brain-gut axis. So brain-gut axis connection is very important. Of course, certain proteins are connected, certain signals are connected. There is some connection between brain and gut with the help of signals and proteins, right? Okay, that's a very big connection. And what's the second question, please?
I think the
Continuation of that. Some stress you just read.
yeah. It was the factors influence this axis and overall impact overall health. How does?
I mean, stress and food, something, food also.
Yeah.
Yeah, I can explain the same. See, as I just told now, there is some connection between brain and gut with the help of protein connection, or simply called as brain-gut axis. Yes, that is number one. With that continuation, see, certain foods like high carbohydrate diet, and even certain foods like, especially, I'm highlighting few foods here. Number one, egg, corn, egg, corn, even milk and wheat products, wheat. So all these high carbohydrate diets are really harmful for our health, because for a long time, if you're taking like milk or corn or wheat, it is really metabolized into 5-HT, 5-hydroxytryptamine, and further this 5-hydroxytryptamine is metabolized into 5-HIAA, 5-hydroxyindoleacetic acid, which is really very harmful, which causes, of course, depression and suicide. So this is one more factor. So really, because of that food pattern, there is some connection between brain and your GA tract. Because of food which we take, like it could be like just now I said, milk, egg, and of course wheat products and all. It is metabolized into 5-HT. And you may ask me one question: how far it is really hitting the brain, and it causes mental illness? Yes, of course, it causes a blood-brain barrier. There is one part called blood-brain barrier. So nothing can pierce into the brain without this permission of blood-brain barrier. This blood-brain barrier fails, and of course it allows, so it causes mental illness severely. It's the right answer, I think. Thank you.
Perfect. Thank you so much, Dr. Sampoornam. You even provided more insights, not only the answer. Thank you so much. As expected, and even more than expected, I would say. So any more questions from Dr. Sampoornam? Or any of our speaker? Miss Neha Ghanshani, can you please repeat the questions you were asking from Mrs. Aparna, earlier you asked the questions related to the Parkinson's disease. I could see. You could repeat the questions here. Okay, Meghna wants to ask a question. Meghna, is it a common question, a question to all of our professionals present here, or specifically asking to someone? Yes, for all. Okay. The question is, she is making a computer science. I'm sorry. She's a computer science student, and she wants to create an app using AI where it helps for mental health. She's asking what factors do she need to consider or include in the code apart from mood track? The question is directed to all. I would request all of our speakers, in fact, at least all of our speakers, to come up and answer if they find any feature that should be in that app. Come on, it's very interesting. She is going to create something very interesting. All the very best to Meghna. So let's start from Dr. Sampoornam itself. She's very tired and I'm still keeping her.
Yes, still
active.
I can address the question, Gazelle.
You're so sweet. Thank you so much.
Yeah, that's great. And she's about to create an app for like mental health, right?
Yeah.
She's a computer student, and with the help of artificial intelligence, she's just trying out. Okay. And she's about to do mood tracking, I think. Mood tracking,
Yes.
right? I would like to know whether she can make some like mind reading. Can she answer this question? Some mind reading.
Meghna, unmute yourself. You can unmute yourself and discuss it thoroughly. And if it is not possible, you can reply there. I think it is the best opportunity to, yeah. She's a first year student. So Meghna, is it possible for you to do some mind reading as a feature? Dr. Sampoornam asked.
So I suggest to just go for like mind reading, because mind reading is a part of like artificial intelligence. Many are trying that, and she can also add that part in her designing, while designing the app. Of course, certain emotions level can be controlled, right? So if I'm angry, I should know that I'm angry. If I love someone, I should know that I'm loving. So that insight she has to create with the help of artificial intelligence. I just wish her all the best. God bless.
Thank you so much. Yeah. Anything else you would like to ask, Meghna?
Basically, I'm at learning stage. I haven't started anything yet, but I have an idea to create it. I don't know how to start it and what are the requirements. So,
All right. You
And
just
for
got
Magna, I'm here to give one more point. The thing is, there are so many mannequins available, like delivery mannequins. I'm just talking about the medical field. Like so many mannequins are available. But so far in mental health, I mean, to learn mental health and issues, of course, like schizophrenic client, depressive client, or any mood disorder, or any stress-related disorders like anxiety, obsessive compulsive disorder. So far, we don't have any mannequins. So with the help of artificial intelligence, even you can design mannequins. So I suggest her to go for some, for designing some mannequins also for healthcare professionals. Thank you.
Thank you.
there. You got the ideas, Meghna. Thank you so much, Dr. Sampoornam. Okay, so we are having question. Okay, thank you so much, team, for pasting us for keeping the question and sending us the question from Neha Ganshani in the meeting room. Thank you. The question is to Mrs. Aparna. We are having Mrs. Aparna in the meeting room right now, right?
Yeah, yeah. Yes, I'm available here, dear.
Thank you so much. So you are able to read the question, or should I read the question for you?
No, I will read it.
Okay, thank you so much.
Yeah. Actually, the question is, what are the most promising pharmacological and non-pharmacological interventions for managing cognitive and behavioral symptoms in Parkinson's disease, and how do these interventions target the underlying pathology? Dear, I think I already explained about both the pharmacological and the non-pharmacological management, including the surgical also. In that, the first is pharmacological. It's levodopa. Yeah, she's correct. Dopamine agonist and anticholinergics. These are the pharmacological wise we are treating the patient. And the non-pharmacological interventions for this cognitive and behavioral symptoms in Parkinson's patients are mainly exercise and like cognitive training, behavioral therapy, and support groups. I think this also explained in the slide. And the some of the points I am adding additionally that we should find out the severity of the symptoms. If the symptoms are severe, then more likely the medications also will be needed. And we will consider the patient age and the health of the patient. And some patient, they are not at all, they are refusing the medications. For like that patient, we are first trying with the non-pharmacological interventions before starting the medications. These are the main things we are following for this type of patients.
Thank you so much for addressing the question, Mrs. Aparna.
Yeah, thank you, dear. My pleasure.
There is one more question from Ms. Neha Ganshani, and that is to Ms. Yaren. Team, do we have the question?
I can answer if you want right now. The exact mechanism of the action underlying schizophrenia is not fully understood because it's a complex and multifunctional psychiatric disorder that's likely arises from a combination of maybe genetic or environmental or neurobiological factors, and we have lots of theory for this question, like dopamine hypothesis, glutamate, neurodevelopmental factors, like this.
Great. I think Ms. Neha got the answer. Thank you so much for addressing the question, Ms. Yaren.
Yeah.
Any more questions we got? And thank you so much for add-ons to Ms. Preeta. Any more questions from any of us, as it is our questionnaire session? All right, till the time we are getting more questions, it's time to ask for the details which we'll be using for the certificates preparations. So anyone who is there in the viewers of LinkedIn live stream session, so if you have registered already, please make sure you come up in the meeting room right now and provide the details I'm asking for. The details we need from you for the certificates preparations is not to the speakers. The speakers can skip this, as we already have all the informations we need to prepare your certificates, but to the attendees. Yeah. So all the registered attendees, please make sure you share your full name with the title. What's your title? It's Doctor, Professor, Miss, Mr., what you use. Yeah, the title with your full name and your email address and your country name as well. Please share these details in the chat box. Till then, if we are having any questions from any of our speakers, please feel free to ask your questions. Okay, Dr. Sampoornam, there is a question for you. I'm sorry, you might be needing to sleep right now as you are very tired. Being a principal is very tiring.
Please, I'm ready to answer.
That's the energy I always need. That's the energy keep me motivated. Thank you. So Dr. Sampoornam, the question is from the same girl named Neha. She's asking, are there specific demographic or age groups for which mental health chatbots are more effective? And how do you tailor the chatbot's response accordingly?
Chatbot, see, the level of understanding is important. That's it. Age doesn't matter. If a child can understand the concept, or a child is having enough comprehension, this chatbot can be given to a child also. So that is one thing. And tailoring, in the sense, chatbot is having a chip called, which can really understand the need of the particular individual, and it can analyze and it can give some answer for the crisis. So that is inbuilt within the chatbots. And the thing is, if there is really the person is having comprehension, anybody can use a chatbot. Thank you.
Thank you so much for the answer. Any more questions? As I'm sure everybody is getting their answers right now. Dear attendees, please make sure you are sharing the details I asked for to everyone, not specifically to me. Yeah, it should not be a direct message, but a message to everyone when you share the details. Please make sure of it. All right, this is open questionnaire time. So anybody having any question related to any talk or the question from us, please go ahead with your questions. All the attendees in the meeting room have shared the details, I guess. I repeat, those who are registered and who will be registered from our website will be provided with the certificates, having the condition that they have joined the event and have joined the event for at least 70% of the full duration of the event. Yeah. Thank you so much. I guess everybody has shared the details I asked for. That's okay. That's okay, Miss Patricia. I remember that. Anyways, you introduced yourself earlier, and I remember that already. Thank you. Those who are asking on the LinkedIn Live, please make sure you are registered. All right. Okay, so the questionnaire time, the open questionnaire time. Any question from any of our speaker, any topic you would like to discuss, and any question to me, my team, the OLCIAS team. The questions are welcome. Yes, it was a thought-provoking and interesting conference, and thank you so much for your words and your presence. So let me keep the meeting room open for the next 10 minutes. In case you are having any questions, the team will answer you. It is the time to say goodbye, and we will definitely meet in our next event. Did I mention our next event? I guess not. So everyone, our next event will be on brain, mind, and artificial machines, artificial intelligence machines. Here is the direct link for our next event, or you can simply go to our website, find out all the details of all of our upcoming events. And there's one of our speaker, Dr. Dilshad Dayani. She'll be presenting in our next event. She's our confirmed speaker right now. Thank you for all of your praises, and thank you so much for joining us. All right, we will take a leave now. Thank you so much to all of our respected speakers.